just making sure we can see the screen. Is that right?
Yes.
Yep.
All right, perfect. All right. So good to meet you. My name is Vahid. I'm the founder of Pocket, the AI operating center for care centers. 83 million people in the US have a disability, and there's today not any effective way to deliver services through programs in a way that's scalable. My background, I'm close to this. My family has been providing support and job training to adults with intellectual and developmental disabilities for over 25 years. I worked in every role, as you can imagine, in my family's business before taking time to go to work in technology. I was very lucky to be a part of the team at Appfolio. We took it public in 2015, and I've been a part of the team at Zapier as well, which is a Y Combinator darling. Many of us are solving for workforce and workflow issues that are problematic. Over 1 million people serve this community, and today 21 million documents at least are created in support and service and administration of the clients that they end up serving, eating up a bunch of time for low-skilled and hourly wage employees. This is a sample of the types of documents that are occurring in just one program. And you can imagine as force multiplication, this eats up a ton of time for people to take them away from the job they came to do, which is provide support to individuals with disabilities. This is an example of a legacy product. They're outdated. Many of them don't even have mobile application. We took a look at the 10 biggest competitors in the market. Only 3 did. And the reviews for those top 2 were pretty bad. You can see 1.9, 2.6 here for the major players in the space. There's an idea that we came up with, and that's crafting a graceful solution. We call it Pocket. So we plan to have it be as user-friendly and clear as Instagram is for the user, with the power behind it like ServiceNow, meeting all of the compliance requirements and multilingual, multimodal, and leveraging AI as well to be able to provide support with a mobile-first approach. We are not an electronic health record system. We intend to replace pen and paper, automating workflows and providing an opportunity for machine learning to deliver better care plans for future care. We position ourselves as a replacement to the legacy products. We will integrate to modern electronic health record systems, and we will power gig economy-based behavioral health programs as well as the underlying support. We're not the marketplace. We did a bottom-up market sizing. We took Department of Labor numbers. We found around 700,000 care centers. We targeted those with disabilities in them. We said we would try to get to 10%, and even if we're at 2.5%, we're still a unicorn in the way that we slice that. We've got a great pipeline. We've got customers paying for the product. We use a SaaS model between 15 to 35K. The per user seat is around $9. And we've got great discussions with partners for distribution. We're raising $1 million on a safe, a 10 cap. Right now, we've funded 250. We've got a great team.
Thank you, Vahid.
We invite you to join us.
All right. Excellent. Craig, what are your thoughts?
I still am kind of curious or confused as to like, who are you replacing? And is it just like a straight up replacement? Or like, are these providers now going to have to use you plus these other like monolithic, like these huge old platforms that have, I mean, that screenshot with those reviews was hilarious. Like, holy cow. So I get it, but yeah, I'm just curious, like, are you a replacement or are you going to be like an add-on? Curious what the other panelists think, because I just kind of blew my mind when I saw that terrible review slide.
Nope. Actually, I had a very similar question. I also wasn't clear that I think that they mentioned that they are in pilot. I don't know how ready or how baked in the product is. I saw a lot of info on that we will do this, we will do these integrations, we'll build this AI model. I'm not really sure that how ready the product is. If I were to compare that with some of the other presentations.
Yeah. So here's the thing. I'm not 100% sure who the customer is. I've left not being 100% sure what the product is also, but I'm going to give some leeway that this is maybe because this is such a specific healthcare field that I'm not familiar with it enough. So I'm just a little bit confused in terms of what is the value add? Why would there be a switch over? Who's the customer? What is the size? What is the onboarding process? So this is my my outtake.
Great. Excellent. Thank you, Tatiana. All right. Let's go back to you then, Vahid. I think you're on mute, Vahid, if you're speaking.
We lose Vahid?
Might be frozen. Looks like his screen is
Well, time is running out.
all right. We almost made it through with 0 hiccups. There you go.
All right, here we are.
There we go.
We talked about the Zoom doing an update automatically, right? So there it was.
There you go.
Okay, so I got 3 questions, or the 3 panelists' questions. The first one was, who are we replacing? We are replacing those. We are replacing those legacy systems. So the TheraApps and the Sandatas of the world. Our goal is to be the next iteration, the next generation, and future product in the space. Most of them are built in the early 2000s and have no downward pressure or no upward pressure coming into them right now in that market and in that space. Craig, are we ready, Rasa? I think you always ask the best questions. You've always done that historically, so thank you for continuing the trend. Yeah, I mean, the idea is we're in pre-seed and pilot stage, right? So our goal is, in this specific moment in time, is to find and identify somewhere between 5 to 10 anchor customers that will be the place where we can do force multiplication on it. Today we have 4. We have 2 more in pipeline, one that verbally closed last Friday for a very big company as well that's providing this service. So yes, the idea is that we will be doing all of the work with them in the pilot stages, the design partnerships, the user testing, and all the other things that we need to be able to capture from them in order to make the product exactly in the place that we need to scale past pre-seed stage. And that's the goal of where we are with our fundraise. Tatiana, to your question, who are the customers? I run into this question so frequently because people with disabilities are so unseen. It's very difficult for people to conceptualize where it is. So the way I try to define it is we are building a product for where people with disabilities live and where they work. Typically, people think about medical tech as like a doctor's office, and you see people for an hour at a time. But there are 23 other hours in a day where people are receiving home care, job training, transportation, and every other variety of social service that lives underneath it. And those are our ideal customer profiles. Those are the companies that would use this as an IT line item expense.
Great. Thank you, Vahid, for that.